But first I just want to go over the symptoms that I had. There's short-term memory loss, which is if you have trouble remembering phone numbers, something you just heard, that's basically short-term memory, something you just see or you've just heard. Memory formation, that was, without a doubt, the loss that occurred with the incident with my daughter. You know, it was like, she said it, it did not stick. And I actually could talk about the brain and memory for hours, but I'm trying to just give you like a little synopsis here. Motor function loss is pretty interesting. There are these two seahorse-shaped structures in the brain called hippocampus, one on the right hemisphere, one on the left. And that's where the formation of new cells, you've heard of stem cells? These are neural stem cells, and I'll show you a picture diagram in a minute, are formed. And so what can happen is that also is the seat of your geographical memory, your navigation. So if the hippocampus is damaged, you're going to have difficulty remembering how to get to places. Anybody have that symptom? Forgetting, like, okay, I just was here, you know, last year, why can't I remember? And I do that, I go to the wrong room sometimes. That's probably the last thing that I have that's still left over and may never change. I really think I'm going to the pantry, but I end up in the laundry room. It's not absent-mindedness. I really believe while I'm walking there that I'm going there and I just end up in a different place. And that's the one thing that's left over. Word retrieval difficulties, expressive language, things like the word egg, or I'm going to the, and you can't, I mean, most of the time you can remember garage, or you can remember living room, but for whatever reason, it's like there's this gap, and that word just isn't there, and you can't remember that word to save your life. Yeah. So those are difficulties, and then decision making. That's also related to the fog. If you feel like you're in a fog, it's really hard to make a decision because you can't map out the possible alternatives to different actions if you're in that fog. And that's one of the top symptoms of chemo brain. So hopefully you'll see that I think I've fully recovered, but sometimes my family says, no. We'll see. So what really do we mean by chemo brain?